Heart disease is the leading cause of death among seniors, accounting for nearly 1 out of every 3 senior deaths in the United States each year. That's why it's so important to be aware of the signs of heart disease, so that you can take steps to prevent it or seek treatment if you need it. In this video, we will discuss 10 early signs of heart disease that all seniors must know about. Stay tuned until the end, because the last one might surprise you. Be sure to subscribe and turn on notifications so you never miss a life-saving video. Let's get started. No. 1. Shortness of breath. When you have heart disease, your heart isn't able to pump blood as efficiently as it should. This means that your body doesn't get the oxygen it needs, which can make you feel short of breath. You may notice that you're struggling to catch your breath when you're doing everyday activities like walking up a flight of stairs or carrying groceries. If you experience shortness of breath, especially when you're exerting yourself, it could be an early sign of heart disease. It's essential to consult with a healthcare professional to determine the underlying cause and receive appropriate treatment. Number 2. Swelling in the legs, ankles, or abdomen. Leg swelling is usually caused by fluid retention. When your heart isn't pumping effectively, it can cause fluid to build up in your legs, ankles, or abdomen. This fluid retention, also known as edema, can be a sign of heart failure, a condition in which your heart isn't pumping blood efficiently enough to meet your body's needs. Heart disease and heart failure are closely related, and the presence of swelling could indicate that your heart isn't working as it should. So if you notice any unusual swelling in your extremities, it's essential to seek medical attention promptly. Early detection and treatment can help prevent further complications and improve your overall health. No. 3. Persistent cough or wheezing. A persistent cough or wheezing could be an early sign of heart disease, particularly a condition called congestive heart failure. When your heart isn't pumping effectively, it can cause blood to back up in your lungs. This can lead to fluid buildup, inflammation, and irritation of the lung tissues, resulting in a chronic cough or wheezing sound during breathing. Additionally, heart disease can cause blood pressure to rise, which can strain the arteries in your chest, leading to a chronic cough. If you're experiencing a persistent cough or wheezing that doesn't seem to go away, it's crucial to consult a doctor. They can assess your symptoms and determine if there's an underlying heart issue contributing to your respiratory problems. No. 4. Fatigue or weakness. When your heart isn't functioning at its best, it can cause you to feel fatigued or weak. This is because your body isn't getting the oxygen and nutrients it needs to function properly. For example, coronary artery disease, which is the most common type of heart disease, can cause chest pain or angina. Over time, this can lead to fatigue and weakness. Additionally, heart disease can cause anemia, which is a condition in which your blood doesn't have enough red blood cells or hemoglobin, the protein that carries oxygen in your blood. Anemia can also cause fatigue and weakness. If you're feeling unusually tired or weak, it's important to talk to your doctor, especially if it's accompanied by other symptoms like shortness of breath or swelling. While fatigue and weakness can be caused by various factors, it's essential to rule out any underlying heart issues to ensure your overall well-being. No. 5. Chest pain or discomfort. Chest pain or discomfort, also known as angina, is a classic symptom of heart disease. It occurs when your heart isn't getting enough blood and oxygen-rich blood. This can happen when the arteries that supply blood to your heart are narrowed or blocked, which is a hallmark of coronary artery disease. The discomfort typically feels like a pressure, squeezing, or aching sensation in your chest and may radiate to your arms, neck, jaw, or back. It's essential to take chest pain seriously, as it could be a sign of a heart attack. If you experience any chest pain or discomfort, even if it goes away quickly, you should seek medical attention immediately. Early intervention can help prevent further complications and improve your long-term health outcomes. Number 6. Changes in blood pressure. High blood pressure, also known as hypertension, is a significant risk factor for heart disease. When your arteries are narrow and stiff, your heart has to work harder to pump blood throughout your body. Over time, this added strain can damage your heart and blood vessels, increasing your risk of developing heart disease. On the other hand, a sudden drop in blood pressure can also indicate heart problems. This can happen when your heart isn't pumping effectively, causing reduced blood flow to vital organs. Changes in blood pressure, whether high or low, can be a sign that your cardiovascular system isn't functioning as it should. If you notice any unusual fluctuations in your blood pressure, it's crucial to consult your doctor promptly. By monitoring your blood pressure regularly and addressing any concerns with your healthcare provider, you can take proactive steps to protect your heart health and overall well-being. 7. Arrhythmia. An arrhythmia is a problem with your heart's rhythm. It can cause your heart to beat too fast, too slow, or irregularly. This can disrupt the normal flow of blood and reduce the amount of oxygen-rich blood that reaches your organs and tissues. Some arrhythmias are harmless, but others can be a sign of underlying heart disease. For example, atrial fibrillation, a common type of arrhythmia, has been associated with an increased risk of stroke and heart failure. If you experience symptoms of arrhythmia, such as a fluttering in your chest, dizziness, or lightheadedness, it's important to seek medical attention. Your doctor can use an electrocardiogram, ECG, to monitor your heart's rhythm and determine if there's an arrhythmia present. They can then develop a treatment plan to manage your arrhythmia and reduce your risk of complications from heart disease. Number 8. High cholesterol. High cholesterol levels are a major risk factor for heart disease. When you have high cholesterol, there's a buildup of cholesterol in your blood, which can cause plaque to form in your arteries. Plaque is a substance made up of cholesterol, fat, calcium, and other substances that can harden over time. As plaque builds up in your arteries, it narrows your arteries, making it harder for blood to flow through them. This can lead to heart disease by reducing the amount of oxygen-rich blood that reaches your heart and other organs. High cholesterol often has no noticeable symptoms, which is why it's called the silent killer. That's why it's essential to have your cholesterol levels checked regularly, especially if you have other risk factors for heart disease, such as diabetes or a family history of heart disease. If your cholesterol levels are high, your doctor may recommend lifestyle changes, such as eating a heart-healthy diet and getting regular exercise. In some cases, medication may also be necessary to help lower your cholesterol levels and reduce your risk of heart disease. 9. Diabetes. Diabetes is a chronic condition that affects how your body regulates blood sugar, or glucose. People with diabetes have high blood sugar levels because their bodies either don't produce enough insulin or can't use insulin effectively. Insulin is a hormone that helps move glucose from the bloodstream into cells where it can be used for energy. When there's too much glucose in the bloodstream, it can damage blood vessels, including those in the heart and brain. Over time, this damage can lead to heart disease and stroke. Studies have shown that people with diabetes have an increased risk of developing heart disease and that the risk increases with the duration of diabetes. However, it's important to note that not everyone with diabetes will develop heart disease. By managing your blood sugar levels, eating a healthy diet, and staying physically active, you can reduce your risk of developing heart disease and other complications related to diabetes. Number 10. Family history of heart disease. If you have a family history of heart disease, it means that one or more close relatives, such as your parents, siblings, or grandparents have had heart disease. Having a family history of heart disease can significantly increase your risk of developing it yourself, even if you don't have any other risk factors. This is because certain risk factors, such as high cholesterol, high blood pressure, and diabetes, can be passed down genetically. If you have a family history of heart disease, it's essential to take steps to protect your heart health. These steps include eating a balanced diet, getting regular exercise, maintaining a healthy weight, and not smoking. You should also consider talking to your doctor about your risk of heart disease and whether you should get screened for it. By taking proactive steps to manage your risk factors and following your doctor's recommendations, you can help reduce your risk of developing heart disease. If you've enjoyed this video, please like and share it with your friends and family. Don't forget to subscribe and turn on notifications so you never miss a life-saving video. We wish you good health and a happy life.